My name is Maureen Burns. I use she, her pronouns, and I currently serve a dual role. I work as the Northside Community Health Worker and also the Director of Community Health. So as a young person, I just kind of made a decision that I wanted to work in healthcare. I thought there's gonna be jobs and I wanna help people. But other than that, I didn't really have any idea of what kind of healthcare. And I had a lot of struggles financially that, made me feel like I'm not gonna be able to, go a traditional college degree. So I was really looking for healthcare jobs that I could get quickly. And I ended up becoming a pharmacy technician and doing that for a number of years. And then it was when I decided to change and leave that field. And I just kind of, on accident, when you're looking on Indeed or looking wherever for jobs, I just kind of came across not only a job posting for community health worker, but it was an apprenticeship. This particular apprenticeship was what is known as an earn and learn apprenticeship. So yes, they sent us, paid for, covered the cost of our training, and that training was also incorporated into our workday. So the idea that school and work could be combined in 8 hours, I think is really appealing to so many people, especially people who may be, parenting or caregiving. I think that was also really important for me because that was the first time that I had been back in a formal educational academic setting. I was able to do that semester program and get good grades, and that made me kind of think, well, if I can do a semester at Malcolm X, maybe I could do quote unquote real college. And that really encouraged me because I was also at that point kind of thinking if I'm gonna go back and further my education, I probably wanna go all in and get a master's, right? Because that's probably what's gonna lead to me having access to director roles or a higher salary. And so that was when I was thinking 4 years for a bachelor's degree and then maybe 3 years for a master's degree, it felt like a lot. But knowing that I could maybe do the bachelor's quicker was a real selling point for me. And so I did, apply to that same program at Northeastern Illinois University, the University Without Walls program. It's an amazing program. I tell everyone that I meet all about it and try and convince people to do it because it was just amazing. And so I learned a lot and I was able to get my bachelor's degree in just a year. I'd say probably the majority of our time is spent trying to connect with people in the community, trying to build relationships that will allow us to go in and deliver free education. One of the things that drew me to this work is not only the things that I'm passionate about, but also my lived experiences. But I think that is one of the things that I really love about this work is trying to be that person that I didn't have, or trying to be that lifeline for someone who might feel they go into, interact with healthcare and they feel like they're disrespected. They feel like they're a number. They feel like nobody sees them as a real person, a human. And so that aspect really appeals to me, the opportunity to engage with people and try and build trust with people, I think is really, really gratifying.